The Uganda Cancer Institute at the National Referral Hospital in Mulago is a centre of excellence for cancer treatment in Uganda. But the government facility has no drugs.
We as people who look after patients and have to actually sometimes see them go back home without drugs or see them wait around for drugs. It affects us, it demotivates us because we chose this profession to help.
Patients seeking cancer treatment here now have to make endless trips to pharmacies to buy drugs that cost between 100,000 to 300,000 shillings per dose. The doctors at the Cancer Institute have been reduced to just prescribing the drugs. Patients at government health facilities are not supposed to pay for drugs. Officials and patients painted the grim picture of the Cancer Institute to members of the Parliamentary Committee on Health who visited the facility to understand its operation challenges.
So when you see a patient who you think would have done better, not doing well, because they only cannot afford, maybe they can afford one drug and they need 3 drugs.
We have already made the orders with the National Medical Stores. I think they may be having an answer to that.
Some of the people here who spoke to NTV say they sometimes painfully look on as their relatives die because they cannot afford the medication. For about 2 months now, officials of the National Medical Stores that is mandated to buy and supply medicines to government hospitals have been engaged in a war of words with their colleagues from the Uganda Cancer Institute over drug stockouts, inadequate and or wrong drugs supplied.
This time around, I have communicated to the director of Uganda Cancer Institute, rejecting his procurement plan which he sent to National Medical Stores for this financial year. Why? One, as we had said earlier, every health facility gives us their procurement plan for NMS to plan to get for them what they need early in the year. By May, we should have received that procurement plan. That procurement plan reached National Medical Stores in July.
One of the key issues in contention is the price of drugs, with the Institute claiming that NMS overprices them. Officials of the Institute say they lose 2 billion shillings annually in the overpricing of drugs. But the medical stores has previously blamed this on technical glitches and disagreement on the types of drugs sought by the Cancer Institute. In March this year, Uganda's only radiotherapy machine broke down, causing an uproar across the country. The construction of the new bunker to house the new machine is underway and it's expected to be ready in May next year. Earlier, it was expected that the Cancer Institute would repair the old radiotherapy machine as the new bunker is constructed. But no money has been allocated for the repairs.
There were some funds that were left over from the Ministry of Health that was supposed to be used for doing that work. Unfortunately, the process did not materialize, and that led to money getting lost. For that matter, we don't now have the money for the rehabilitation of that old bunker.
So unless government gives the Institute 16 billion shillings for this purpose, cancer patients in need of the critical radiotherapy services will either have to travel abroad, remain without treatment until May next year, or face imminent death. As part of the Memorandum of Understanding signed between the Uganda government and the Uganda Cancer Hospital in Kenya, government has so far sent 12 patients of the 400 slots offered.
The unfortunate part of it is that we, for up to, I would say, up to even the point I'm talking now, we haven't yet got the funds for the aspect of that agreement that the government is supposed to meet.
It's not all doom and gloom though at the Cancer Institute. Officials say the center is recognized globally in cancer research, but their main undoing is inadequate funding. Shiran Dochere, NTV.